some interest in universal health coverage and health system strengthening being better reflected in the global health architecture, and there was a kind of call for the IHP Plus, which is this partnership that was founded about a decade ago to focus on effective development and cooperation, to expand its mandate and consider becoming a broader health systems partnership for universal health coverage. Next slide, please. So the process to date has been that there's been some sort of high-level political momentum on this agenda. In 2015 at the UN General Assembly, Japan and Germany both made quite a lot of focus on universal health coverage and calls for better coordination at global and country level on health system strengthening efforts. There was a discussion amongst the steering committee of the IHP Plus from November and subsequently at various steering committee meetings since to explore the potential for it to expand its mandate. Based, as I mentioned before, there was little appetite on setting up a new global mechanism, but also the opportunity that IHP Plus presented as already being a sort of health system-wide partnership, albeit with more of a focus on aid and that relationship with countries rather than for all countries. So in May 2016, it was agreed by the steering committee that this mandate would expand, which has implications on the scope of work and also the membership of the partnership. And there's been various sort of announcements of support for this evolving mandate. For instance, the G7 articulated that in their statement. It was mentioned also in the TCAD communiques. In June, the IHP Steering Committee agreed to this transformation, and they agreed that the name would transition from the IHP Plus to the International Health Partnership for UHC2030, which is now being commonly abbreviated to IHP for UHC2030 or UHC2030. And the process for transformation is underway, so that process will take us through to the next sort of, to the operationalization of this evolving partnership. Next slide, please. So this slide presents a diagram that tries to sort of reflect what the partnership is about to some extent, or who's involved. So it's really a multi-stakeholder partnership that tries to be more reflective of the different stakeholders that pertain to the health system strengthening and universal health coverage agenda within the context of the SDGs and the universal nature of universal health coverage. So the idea is that you still have a multi-stakeholder governance mechanism and a secretariat that would be co-hosted by the bank and WHO, and that the partnerships that are affiliated with the agendas for health system strengthening and universal health coverage would have a stake in this broader partnership on UHC. So the other networks and partnerships that are related to health and health systems are represented as bubbles around the periphery of the circle, and the civil society engagement mechanism, as you will see in light blue on the right, is this initiative that Annick will discuss in more detail, that is to feed into and contribute to the work of the partnership, but also have some autonomy and independence from it and be a broader movement for universal health coverage, or help to support this broader movement from a civil society perspective. This will help to, this whole partnership initiative will try to influence some of the broader processes around the SDG accountability agenda. So there are dotted lines to those mechanisms, and we need to figure out exactly how we will contribute to that agenda. The next slide, please. So what the steering committee has agreed so far is this process, is the name, and is the broad aim and objectives of the partnership. So the aim is for a movement for accelerated, equitable and sustainable progress towards universal health coverage, as well as other health targets in the SDGs, including global security and equity. The objectives are fourfold. The first is around improving coordination on health system strengthening efforts at global level, and that includes synergies with these other related networks and partnerships. The second is around strengthening multi-stakeholder policy dialogue and coordination on health system strengthening in countries, which includes adherence to the IHP Plus principles and behaviors, sustaining the focus on effective development cooperation that has defined the partnership to date in countries where it's still relevant. The third is around facilitating accountability for progress towards health system strengthening and universal health coverage, and there's a sort of subset to that that's around trying to support a more integrated approach to accountability for health in the context of the SDGs. And the fourth is around building political momentum for a shared global vision and advocacy for sufficient and appropriate resource allocation to health system strengthening. So this is more about advocacy and political will. So those are the four objectives that we're now trying to work with and unpack to determine how can we contribute to achieving these, with specific focus on what can we be doing in the next year or two, and then a broader kind of direction of travel. The next slide, please, is about the steps for this process of transformation. So there's been various stages to this process. It's no doubt somewhat rushed. I think there's a tension between getting everything right and making sure that we don't get stuck in process forever. So it's not easy to negotiate and balance. But we've been trying to be as transparent as possible and as open to inputs from different stakeholders who are keen to engage as possible. So there have been various consultation efforts. In June, there was an in-person meeting held and then an online survey that has recently closed, and the inputs are being synthesized at present. In fact, there's a very heavy series of inputs from civil society, which is very welcome and helpful. And that will be synthesized and available online as a report so that people are able to see what the spread of inputs we received are, and we will hopefully reflect a response to some of that in our ways of working moving forward. There's been targeted outreach and continues to be to different constituencies that aren't traditionally involved. So for instance, we're keen to better engage middle-income countries who may not be so concerned about the agenda of aid, but may be, still have huge commitment to UHC and challenges in implementation of health system strengthening towards the goal of UHC. So that's one of the communities that we've been exploring. Another community that we're considering how to best engage with is the private sector, the for-profit private sector, for instance, that hasn't traditionally been involved in this partnership. And as mentioned here, there's of course a specific consultation underway on the civil society engagement mechanism. So in December we will have our steering committee meeting. It will be a steering committee which is the existing steering committee plus some potential prospective interested members. So we hope that the voices and interests of those potential new members will be heard as part of this transformation process and able to shape the direction of travel. They will consider three things primarily. So one is updating the Global Compact. As some of you may be aware, what bounds together the partners for the IHP from 2007 onwards was a Global Compact that expressed the principles of effective development cooperation and the ways of working towards improving effectiveness of aid. And that's obviously, it was contextualized by the MDGs, so it needs to be updated, but also reflect this broader scope and so on. So that's one of the things that we're hoping to get some discussion and agreement on. There will be an updated work plan for 2017 and also some thinking about the future governance structures for the partnership. Because of this shift in mandate and membership, it's an opportunity to review how the partnership is organized and governed in order to be most effective in engaging partners for collective action. We've been organizing a series and co-organizing a series of events to keep the momentum on the agenda and provide updates on progress of this process. For instance, one was held during the UN General Assembly at the Rockefeller Foundation in partnership with various member states and others. There will be a series of side meetings to our steering committee meeting in December, which may be technical primarily, but we're also exploring the opportunity of a public event for UHC Day with partners. We'd be keen to hear of others who would like to get involved in that. And in the spring of next year, we are hopeful that there will be new signatories to the Global Compact, so that this partnership can start to take shape in its new identity. That's it from me, so I'll hand over there to Annick unless we want to pause for questions or comments at this stage. Thank you.
Hello, can you hear me?
Hello, Annick. Hi. If you agree, I'd just like to give participants very quick questions of clarification, so not opening the discussion, which we will allow for, but if there are any specific questions to Lara in terms of what was presented, this would be the right time, sorry. So before handing over to Annick, is there anyone who would like to ask a very specific question of clarification on what has been presented so far? You should be able to unmute yourself either using the PC or by pressing *6 if it doesn't work, if you're calling in through phone. No? Start thinking about your questions around this exciting and rather surprising transition from IHP to UHC, but then still ending up being a merger of IHP and UHC. So I'm keen to discuss more at the end. But so Annick, I'm handing over the floor to you, and I'm hoping I have the right set of slides, but if not, please just tell me. So the floor is yours.
Okay. Yes. Okay. Well, yeah, I hope this is the same slide size, I guess. It's, so anyway, I'm happy that everybody thinks it's very clear partnership and everything is fine. Nobody has questions, so it means that Lara did a very good presentation on what is actually the IHP for UHC 2030 and the transition from IHP. So now I have to actually excuse Bruno Rivalan, who is the IHP plus CSO Northern representative, who was supposed actually to do this presentation, but he wasn't available this morning. So as I'm working with him to set up this this survey and to design to help to design this CSO engagement mechanism in their partnership. I'm happy to replace him today and go through this presentation of the CSO. So, for why a CSO engagement? Of course, I guess that Lara also told you before, because this is a partnership with all different types of stakeholders. CSO are, of course, at the center of this partnership. I mean, at the center as the others, but they have very strong. They can have a very strong voice in it, and we would like to have them to have a very strong voice. Well, because first, of course, they can really make a difference and ensure that no one is left behind, following what the SDGs is requesting now. It's really to ensure that no one is left behind, and for the health sector, it's really important to ensure everybody has access to the services and to really highlight or problems or whatever populations or type of populations or areas of people are not really engaged enough in the policies that will be made, included in this new policies and partnership on health system strengthening in UHC. So that's very important, and it's a very key role of the CSOs. It's also to ensure that the needs of the population are taken care of, and also they are always very able to ensure strong accountability towards governments, donors, themselves. And so those reasons are very important to ensure that to engage CSOs in this partnership. It will, of course, be able also to influence policies with a very equity focus agenda. And what is, I think, for us, it's really also important. It's really to strengthen the citizen-led and social accountability mechanism at all different levels, the subnational, national, regional, and global level. So how to ensure that communities, grassroots, organizations are also involved and include in this partnership and have their voice heard as well. The other important point we think it's relevant here is the fact that they will need to have, help to actually to have a better coordination, or let's say even collaboration instead of coordination, not to afraid too many people, but really to see how all these different actors on health can work better together on a health-related issue, where they can, join forces to move ahead and make a difference for health system strengthening in UHC. And that's, of course, specifically trying to take over all the role of the CSOs in the different disease-specific or population-specific. Everybody will keep, of course, what they are doing, but it's just that to ensure that sometimes have a strong push together to ensure the health system in countries are very strong enough, and the UHC is reaching all the people that need it. So what could be the role of the CSOs in this mechanism? So, of course, we need to represent the different voice of the CSO in the steering committee. So, and it's a lot. It's different. CSOs are very, as you know, even better than me, that it's a strong constituency with lots of different type of organizations, type of people, different interests. So the role is to ensure really that as much as possible the CSO voice are really represented in the steering committee. The role would be also to monitor the UHC implementation at country level with the production of an annual report. Either it's a contribution to the report that will be done with the partnership, or another one that is more a CSO one, or both of them. Well, this needs to be decided anyway. But the other very important role will be to facilitate information across CSO network on advocacy and accountability for health system and UHC, from really global to local and vice versa. That's also an important point. And of course, what I said also before, it's coordinating advocacy, consultation, communications in the around UHC processes, and ensure that what is decided at global level is also reflected at national level, and vice versa as well, at local also, of course, level as well. So the role would be to, of course, to collaborate with other related initiatives, global initiatives, as we spoke before, so Global Fund, Gavi, PNMCH, CERN, all the different initiatives already working and having strong CSO constituencies, working on health and above health as well. And the last point would be to facilitate CSO capacity building in terms of doing advocacy, monitoring, in terms of governance as well, and management. So to set up this the survey that was already shared with you, I guess, the online survey to define how civil society should be shaped in this partnership, we first made some interviews of the main global initiative. So in health, but not only in health, we also interviewed people from Education for All, from CERN, to actually get the best example and highlight the what works the best in those CSO constituencies, and to learn from them before shaping this this new role for the UHC for the AHP for UHC. So what we learned from those interviews, it's first, there is a need to have a very clear definition of the role and the mandate of the CSOs at national level. Means that governments, donors, all the different partners needs to know that what is this initiative, this partnership, and what will be the role of CSOs inside in terms of advocacy, but also in terms of accountability. So it's very important that there is a relay on information of what the CSO will do to fit this partnership. It's also important to allow enough seats in the boards to represent CSO and ensure representativeness of the CSO diversity. This is what I was saying before. Ensure that most of the voices of the civil society should be heard. So there is in the questionnaire some question around that as well, and how many representatives do we need and how to organize them. There is also a need to be very flexible when you set up mechanism in countries, because the contexts are very different from one place to another one. Some countries have already have a very strong NGO platform, CSO platform, so we need to look at how they can organize themselves at national level to set up this to set up a link with what exists and not create something new. The other point is really that anything, I mean, if you want to really to engage CSOs and ensure that they work on the different and do their different roles and set up activities, they need financial support. That's very, of course, essential, and all the different global initiatives CSOs representative were very key and very strict on that they need financial support to exist and to run activities. There is a lot of what we saw. It's more and more community-led organizations are actually separating from traditional actors from civil society organizations. For example, in Untitled or Global Fund, they have community-led seats, and they organize actually themselves in parallel. Of course, they do a lot of different bridge between the different constituencies. But it's kind of new trend to really have a community lead, because they just realize that what the needs of the community might not always reach the specifically in terms of advocacy. They are not always the same type of advocacy they would do. So they are complementary, but they need to be organized by themselves. Apart from, okay, well, that's of course the role. Also, which is very important from those partnerships, of those global initiatives, is also the strong role of CSOs in terms of holding stakeholders accountable. And they also all highlight the fact that there is a lack of coordination across the different constituencies in global health, and the lack of broad UHC movement. And all this needs to be actually built. So what we actually propose in the survey that is under discussion is the following way of organizing the civil society engagement. So there would be a CSO, so on the right side you have the UHC steering committee, but then you have the CSO representative in the steering committee, so that would be the people who represent the CSO, would have one voice in the steering committee. You would have a CSO advisory group that is also very helpful to support the CSO representative, as well as the CSOs in country and regional level, and helping secretariat to follow up with ongoing work, but to ensure that all the decisions that are taken in the UHC steering committee can do, are spread in the CSOs, but also highlight just the most important point, to ensure that the voice also from the country are also well heard by the CSO representative, and also help to shape all this the governance inside the CSO mechanism. You would have, of course, a secretariat for the daily work that it's absolutely necessary to make the link between all the different groups, but as well to on a daily basis, do the work for sharing documents, inform people, ensure of the good bridges between everybody, etc., etc. And then, of course, you have the CSO in countries. So how it looks like in country needs to be defined yet, but built on what exists already, or whatever they decided to do. But there will be a strong CSO country representative to work on this partnership, and also because that was what was highlighted by the global initiatives CSOs. It's very good as well to have a regional focal point to really also sometimes make the link between global and local, and also to ensure that in the different countries sometimes they can do some activities together, or they can capacity building, or they can support advocacy as a regional point of view, and have a stronger input in the different in the different international institutions that are in the countries, I mean, in the region. So it's also very important to have this CSO regional focal point. So the next slide is, it's a detail of what I just said now with the different, with the 5 level of organization that I already explained to you. So I don't think we need to go back to this one. The next one is the survey itself. So the survey itself is really, the idea is to put on the table what are the proposals that are coming from the assessment of the other global initiatives, but as well from what the IHP CSO representative from the IHP Plus propose, and to ensure that a broader number of citizens give their opinions on it, agree or not, make some choice on the different options, and captures the visions of the different CSOs and citizens. So it's really actually needed to improve the draft proposal for CSO engagement. So we, of course, we already have more than 100 responses to the survey in 3 languages, in French, Spanish, and English. But we really encourage that the ones that didn't yet fulfill this survey to go there and give their visions and make some proposal as well. Because you can have, I mean, you have part of the proposal of the survey where you can just have to kick some roles, but you also can give some input and make some proposals. So we also did this survey to ensure that there will be a diversity of CSOs, not only the one and the big ones that are always the same, or the international NGOs, but also the national NGOs, and also as much as possible the grassroots and the communities. But it's not always very easy for them to feed an online survey, so we can also print it and give it by and take it back on paper, but yeah, it's important to have the vision of all of them, not too much focus, not too much responses from the same type of organizations. The survey needs to be actually to be filled before October 24th, not 21st, as it's right in here. So there's still some time to do it, almost 2 weeks, to 10 days, sorry. To still answer to the survey. And you can find more information on the website of the IHP, and also I gave at the end of this, on the next, not the next slides, but the end, the link to the survey, and I hope that actually Tim or Abigail will send you again the link to the, directly into the survey. What will be the next step to operationalize the IHP for UHC and the CSO's mechanism? So there will be still some time after the survey to give input or to ensure that you agree with it. We will probably set up some session in Lagos meeting held by Health Data Collaborative Network to also give some feedback from their point of views. We will present it, I mean, the IHP CSO representative will make a presentation to the steering committee of the, what is the proposal for the CSOs, to see what will be the final decision on it, and see how much it will be funded as well, because this is very key to then keep going with the with setting up this CSO constituency. We propose to actually set up an interim group of CSOs to build the CSO constituency. So after the results in December, after the steering committee, an interim group of people that's still totally open and needs to be set up, will actually do the first step for operationalization. Sorry, so they will actually put in place the first advisory group, who will be then able to launch the CSO constituency with setting up the election for CSO representative, etc., etc. So by the time we do that, we hope that this first advisory group will be ready by May 2017, and then we'll be able to start to be engaged in the steering committee. So the last slide is about the link to the survey. So I let Tim and Abigail to send it to you again. If you want more information, you also have my email and Bruno Rivalon emails as well, and you can easily contact us to propose anything or to discuss in more detail some things that you are not clear if needed. So that's all for me.
Thank you, Annick. Thank you for that full overview of the CSO consultation and all the things that are happening. So we'll definitely share the link together with this PowerPoint with all participants and those who could not attend. So time flies, but I would like to ask those on the call to share, raise your questions or share your comments to what you've just heard from Lara on the transition of a IHP Plus model that was set up to guide on the MDGs, which is now IHP Plus for UHC that is need to fit the SDGs and also applies for middle income countries, engagement of private sector, etc. So many questions there that are potential. And then Annick's presentation that was made on the consultation and also making the link between local, national civil society and the global, the differences between community leads and civil society, etc., etc. So a lot there. So I'll stop speaking myself and just unmute yourself, and the floor is yours. Just present who you are before taking the floor for you.
Hi, this is Simon from Save the Children. Can you hear me?
Yes, we can. Go ahead, Simon.
Yes.
Thanks, Tim, Lara, Annick. Thank you very much. I kind of wanted to ask Annick, really, about there are several models for civil society constituencies attached to global health partnerships. And we have, I think, at one extreme, Gavi, which has one civil society person but funds a constituency. But is not probably an effective group, I know, because I've been on it and been not very effective while on it. The Global Fund probably has a stronger model, but if you've been looking at other models, what would you say is the best one, and what should we aim to replicate? Maybe also to hear from Lara if she has a view on that.
Can you hear me? Because I was mute.
Yes.
Unmute. Okay, great. Thanks, Simon, for your question. Well, there is actually different models. What we think should work the best is when you look at the schema I put on the slide with this advisory group, secretariat, CSO regional focal point, and CSO at countries, with CSO's representative in the steering committee. This is something that seems, according to all the different interviews we made with those global initiatives, seems to work quite well. In terms of representation in the steering committee, it looks like to have a community grassroots group for itself with three seats that represent the with a specific one for CSO grassroots organizations and CSOs at more global level and one at more national level. To what I've heard so far and from the others, would work quite well. So I don't know if I answered your questions, but
just for me,
yeah,
thanks a lot for the good question. I think this is part of their work, so Annick has been doing that close reflection. So hopefully the proposals presented will reflect those lessons and suggest why certain options are preferable to others. I mean, I think there's also a balancing act between having a very structured engagement mechanism and something that's lean, and that's something that we're struggling with as well as a partnership, because we don't want to necessarily become heavy and huge as a secretariat, and at the same time, how do you effectively leverage partner engagement without becoming a massive organization yourself. Some of the things that I would want to see from it, which isn't saying what's best, but I think that reflecting some of the less typical voices that we don't hear in the global space as often, so that grassroots and really community-based movement in UHC would be really valuable. How we do that, I think we should be learning from others, but it's not, and I think everybody struggles with this to some extent. As you say, certain partnerships have been more effective and proactive in trying to do so. I think something we're interested in is two things as well. One is that it's not just a mechanism for necessarily engaging in our steering committee. I mean, I think that is, of course, an important function, but it's this idea that the partnership itself is part of a movement for UHC is consistent with the idea that the civil society engagement mechanism is a way of supporting civil society and coordinating civil society around this movement. So I think we'd hope that is the direction that this takes, and with that I think it needs to be really collaboratively owned. So a secretariat in an NGO or something that is seen as the vehicle for this mechanism, but really a partnership and a coalition of members that have voice and a stake in engaging in the initiative. And I think something important, for instance, that comes through is how does it fit with other related civil society engagement mechanisms to do with associated global health initiatives and partnerships is one thing. So around similar convening efforts on similar topics. So for instance, the UHC Day Coalition that has tried to mobilize civil society and other stakeholders around the 12th of December every year and looks to continue. So I think figuring out how these pieces can come together to have a stronger movement for health systems in UHC is part of what this exercise is about.
Thank you, Lara. Annick, so I'm not sure whether you have a follow-up question, but I'd like to invite colleagues on the call who have a question or a comment that's related to this specific issue about civil society engagement, the mechanism and the representation of civil society within the UHC 2030, to raise your question or comment now. I know there's colleagues that also have experience from within Global Fund, so I'm not sure whether you want to share any thoughts on what you've just heard. The floor is yours.
Hi, this is Kira speaking. I'm just really more pointing around clarity. How I'm understanding this diagram is that kind of CSO country level as well as regional level can engage directly with the Secretariat. I want to know that advisory group, is it kind of selected or nominated people that are on that advisory group, and then how are kind of all the interactions going to be happening? Because for me it looks as if we're creating levels but also having pathways directly to the Secretariat and the representatives. So perhaps I'm not understanding correctly, but just some clarity would be appreciated.
Thank you for that question. Annick or Lara, I don't know, Annick, whether you want to reply? Whether you can reply? Annick?
Sorry, I was mute. I was asking actually to repeat the questions very specifically because I didn't hear it very well. I understood it's about the CSO advisory group.
Yes. So the question is, you can see the arrows on the overview. You can see arrows where there's a direct relationship between the national civil society, or expanded, if you like, even community, with the Secretariat, and then the Secretariat also to the advisory group and others. So how does that work? But please correct me if I understand.
Well, this is all right. Okay. Well, this is not the final decision. No? This is something that we put at stake and ask people to say what they think about it, or if they think it works like this, or if they think that there is other options, etc. So this is not the final things. The link between secretariats with CSOs at national level is really more like to, for example, to organize the venue of the people for the steering committee if needed, or to ensure that they have the right papers to answer, or to discuss or to see how to organize capacity building, stuff like that. So it's not only content itself really about the questions or around UHC and health system strengthening. It's really more in terms of basic secretariats. So then the question with the advisory group, I mean, why they should have this direct link between, it's just to ensure that it's also the movement between in this CSO mechanism, it's open. I mean, if there is a need to directly connect with the advisory group, it shouldn't be, you know, like not authorized because you don't have a road that make the link. If there is a need, according to the situation in country, to highlight something to the advisory group, I think, you know, it's just it should be feasible, and doesn't mean that the secretary will not be aware of it. It's just that we shouldn't be too strict in terms of following the level of information or the hierarchy of information between the different groups. It has to be open to ensure that everybody has the right information and everybody can contribute to feed the CSO positions or voice. Okay,
thank you. Kira Lei, I'm not entirely sure whether this responded to your question. It seemed to be. Okay, thank you. Sorry to continue on this, but as our colleagues, many of you are active within other health-specific boards, either at the global level or have the experience of being part of civil society boards, which, like Concord, who also have to relate with national levels. So the question that you raised about the election and to ensure there's a good representativity within the advisory board and hence the representative that will be part of the steering committee. If there's any best practice or things not to do, I think that will be really helpful to share either now or later with Annick and Lara. So I'll let you think if there's any follow-up questions. I had a very specific one to both of you. You mentioned capacity building as well. And I know previously there was a specific capacity training program that was led by Oxfam on behalf of IHP. Is there something similar that has been foreseen that you could refer to, or is that still too early?
No, I don't think we've went so far to this the type of capacity building. For the what we have now, it's to say, okay, if there is possibility to do some, I mean, capacity building is very important. What would be the key areas where you think, this is in the survey, the questions in the survey, where what are the areas where you think is the most important? You would need capacity building, and there is like 3 different options. And you can choose the 3 of them, or you can highlight one, or whatever. Now, of course, all this depends as well to have financial support to do capacity building. And the idea also is because of when we discuss about coordination and collaboration with others, is also to see all those questions of capacity building, how they can be sometimes pulled together to ensure that we can, gather different supports to sometimes to do different global initiatives. Sometimes do their own capacity building. So for advocacy purpose, that's understandable. But for sometimes for other issue, it would be also very important to mix and to ensure that you could do things together on capacity building, because this is also very difficult to get funded, and sometimes as well the same people are working in the different global initiatives, so it benefits to different people as well. So this is why it's important to coordinate at this level.
Okay.
Can I add
Lara,
to that?
yes, I was going to invite you, Lara, to add.
I mean, I think so. Certainly, the partnership is keen to continue to support civil society, of course, in the ways that it needs support. It's not envisaged that we will be the sole funder of this entire civil society engagement mechanism with all that it wants to do, but we certainly envisage that the steering committee would provide some core funding to its operations and, where possible, to activities and so on. We can also help with the coordination of technical assistance to capacity building efforts, and so also. I think 2 things in relation to that. One is what Annick hinted at in terms of how do we leverage efforts that are already underway to strengthen the health system and universal health coverage component of issue-specific capacity strengthening efforts. So, for instance, a conversation has started about potential health budget advocacy trainings that are issue-specific oriented. So, for instance, there is one that's being discussed with a primary healthcare lens for the new year. Now, I think there is an agreement amongst most sub-sectoral agendas that talking at the sector level is important, and understanding the financing agenda, policies and commitments, and tracking resources at the system level is very valuable to understand and contextualize the sub-sectoral agenda within that. And so, where possible, could we be thinking about improving the coherence of the domestic resource mobilization component of some of these trainings, for instance, across different trainings, and leveraging opportunities for collaborative training where appropriate. So that is one kind of idea where I think this partnership could add value and support the civil society efforts to advocate and hold stakeholders accountable. The other thing that we're also considering, and so you referenced the support in the past through Oxfam Civil Society, that was largely around grant giving as well as capacity strengthening. And I think we and many others have struggled with the best models for giving grants to civil society for activities that could be advocacy or accountability or other. And so we are also exploring different options for models for taking this forwards, and whether they sit within the partnership or whether we can use a mechanism that exists elsewhere is to be explored, and whether it's just us or, again, as I've said, I think this is something that we anticipate would be financed from a range of sources, so it wouldn't be just the core team's budget going to support civil society activities on these agendas, but a lot of donors are already funding related activities which could fall into this banner of UHC-related advocacy and accountability efforts, and I hope we'll continue to do so. Thanks.
Thank you, Lara. Thank you both. I'm aware of time, so we're nearly in the end. So if there's a burning question that you have, this is time to raise it. And meanwhile, I'd like to end by passing the floor to Abigail and look at what we can do to further host sexual global health and potential next steps. But I'd like to ask a final reflection from both of you, Annick and Lara, on what you see as a potential role for European civil societies, civil society organizations, NGOs, and typical sexual global health members in this partnership, which has very different type of stakeholders and tries to link the very local community, national level work around universal health coverage to a global mechanism in global talks. So I'll end with that, and the floor is again yours. So with the
thanks. Oh, Lara, do you want to start?
No,
Can you hear me?
Thanks.
Okay. No, well, I think the role of the international organizations, which are European or in developed countries, it's really to make the link with the with your partners in countries and actually ensure that you can reach out the most remote organizations, ensure that they are also part of this partnership and that their needs, their voice, their advocacy work is well heard, and if they need support, that they can really engage, and that you can really support them to get really engaged in this partnership, because this is really for strengthening health systems. It's also really to ensure, of course, part of it's access to health. So it's an important part of the life, and it's very important that those people that are not enough heard at the time being are really having a strong role now, as much as they can in those kind of partnerships. So to be a relay in terms of really reaching out the people that are not always the one that we heard usually, but also to try to work as well in the terms of collaboration and coordination as much as possible with other coalitions and networks, and try to push for that as well, because this is what is going to happen and what needs to happen in the coming months towards this initiative. But we're even beyond this initiative. So this is, I think, the two key things I can see for EU or developed NGOs to work.
Okay, Lara, any final thoughts?
Thanks. Yeah, no, I completely agree with what Annick suggests, but I would also add to it that we shouldn't forget that development partners still play an important role in this agenda at global level and at country level and region in the middle. So I think the role of development partners to sufficiently support integrated approaches and strengthening of country-owned priorities and national health plans and processes for participatory engagement for civil society and others and so on. So I think there is certainly a role of advocating and holding accountable your own governments and the stakeholders and multilaterals that you tend to engage with or are located, headquartered in your constituencies and countries. So I think that is something that I would urge us not to forget. Of course, UHC is a country agenda primarily, but in many countries, development partners play a pivotal role in helping to accelerate progress towards this or not. And we need to keep that pressure on development partners, particularly in a climate where resources are moving away from kind of broad-based health system support as a trend in the region. So I just leave that as a final kind of comment. But yes, I think the opportunity for peer exchange and collaboration with civil society across different types of countries and levels is crucially important and would really strengthen the movement for universal health coverage. Thanks. And thanks again to all of you for participating, and my plea would be for you to be involved in shaping what this looks like and taking ownership of moving it forward so that it really becomes something meaningful and reflects the voices of the constituencies you represent. Thank you.
Thank you, Lara. You can see there's still a bit of civil society within you. Pleased to hear that. So I'd like to hand over to my colleague Abigail to, if you have any points to raise in terms of next steps before closing the meeting.
Thanks, Tim. So just a quick one from me, really, kind of for the UK level. I think just to say that we did engage with the online consultation and submitted a response to this as Action for Global Health UK. And I think there are quite a few of the UK members on this call. So if there is interest to contribute to this civil society specific consultation as well, then that's certainly something that we can engage in as the network, and to be encouraged individually for organisations to do as well. And I can send something after this call to follow up with that.
All right, thank you. So then it's time for me to thank both our speakers, first Lara and Annick, and thanking you all for having participated. It's been, again, nice to organize this webinar, which is my last as coordinator of Action for Global Health, as you might have heard. And so this is also a bit my goodbye and good luck message. But I'll be in Brussels. I'll be working on global health, so I'm sure that we will speak again soon. So,
okay, thank you very much,
thank
Tim,
you
for your support in organizing that. Good luck for your new job. Thanks a lot for what you've done in the past for Action for Global Health, and hope to cross you again. And I, of course, engage. I mean, really asking people to engage in this survey, give their opinions, give their feedback, and continue also to be posted on what will be the next step. And because this is an ongoing, discussions and process, so please do not stop it right now, but keep with us to follow what's happening to ensure we shape a strong voice in this partnership from civil society. Thank you.
Merci, Annick.
Thanks, everyone. Can I say goodbye to Tim as well? It's been brilliant working with you. You've done some amazing things establishing Action for Global Health. The SDG Goal 3 is entirely down to Action for Global Health and all the coordination you did to make sure that something good came out of it. And we're going to miss you.
Thank you for that, Simon.
Good, Tim. Wishing you all the best and keep in touch. Thank you.
Thank you so much. We will. Goodbye, everyone.
Bye.
Bye-bye.
Bye.
Thank you.
See you soon.
Bye.